Gallstones are a common health problem that many people face. They can cause pain and discomfort. Gallstones can even lead to serious complications if left untreated. It's important to understand what gallstones are, why they form, and what you can do about them. In this exploration of gallbladder health, we'll take a closer look at gallstones, their causes, and the warning signs you should never ignore. Knowing the facts about gallstones can empower you to take control of your health and seek timely medical attention when necessary. The gallbladder is a small, pear-shaped organ located just below your liver. Its primary job is to store bile, a fluid produced by the liver that helps digest fats. Sometimes this digestive fluid can harden within the gallbladder, forming small, pebble-like deposits. These deposits are known as gallstones. Imagine your gallbladder as a small pouch. When substances in the bile, such as cholesterol and bilirubin, become too concentrated, they can crystallize and clump together, much like sugar crystallizing into rock candy. Over time, these tiny crystals can grow into larger gallstones, ranging in size from a grain of sand to a golf ball. There are two main types of gallstones: cholesterol stones and pigment stones. Cholesterol stones are the most common type, accounting for about 80% of cases. These stones form when there's an excess of cholesterol in the bile, and the bile can't dissolve at all. Pigment stones, on the other hand, are made up of bilirubin, a waste product produced when red blood cells break down. These stones are less common and often occur in people with certain medical conditions, such as liver cirrhosis or blood disorders. The formation of gallstones is a complex process, often influenced by a combination of factors. Excess cholesterol in the bile is a primary culprit, often stemming from a diet high in saturated fats and cholesterol. But that's not all. When the gallbladder doesn't empty completely or frequently enough, bile can become overly concentrated, increasing the risk of stone formation. This condition, known as gallbladder stasis, can be caused by a variety of factors, including pregnancy, rapid weight loss, and prolonged fasting. Section 5. Risk factors. Who is more likely to develop gallstones? While anyone can develop gallstones, certain factors can increase your risk. Gallstones are hardened deposits of digestive fluid that can form in your gallbladder, a small organ located beneath your liver. They can range in size from a grain of sand to a golf ball. Understanding who is more likely to develop gallstones can help in taking preventive measures. Women, for instance, are twice as likely as men to develop gallstones, partly due to the influence of estrogen, which can increase cholesterol levels in bile. Estrogen, a hormone that regulates many functions in the female body, can cause the liver to secrete more cholesterol into the bile, leading to the formation of gallstones. This risk is particularly high during pregnancy, hormone replacement therapy, and birth control pill usage. Age also plays a role, with the risk increasing as we get older, especially after age 40. As we age, the composition of bile changes, making it more likely for gallstones to form. Family history matters too. If gallstones run in your family, you might be genetically predisposed to developing them. This genetic predisposition can be due to inherited factors that affect the composition of bile or the motility of the gallbladder. If you have a parent or sibling with gallstones, you're more likely to develop them as well. This familial link suggests that genetic factors play a significant role in the development of gallstones. It's important to discuss your family medical history with your healthcare provider to understand your risk better. Other risk factors include obesity, rapid weight loss, and certain dietary habits. Obesity can lead to an increase in cholesterol levels in bile, while rapid weight loss can cause the liver to secrete extra cholesterol into bile. Both scenarios can contribute to gallstone formation. Maintaining a healthy weight through a balanced diet and regular exercise can help reduce this risk. Certain medical conditions like diabetes and Crohn's disease can also increase the risk of gallstones. Diabetes can lead to higher levels of triglycerides, which can contribute to gallstone formation. Crohn's disease and other conditions that affect the absorption of nutrients can alter the composition of bile, making gallstones more likely. And certain ethnicities, such as Native Americans and Mexican Americans, have a higher prevalence of gallstones. This could be due to genetic factors, dietary habits, or a combination of both. Understanding these risk factors can help in early detection and management of gallstones, potentially preventing complications like gallbladder inflammation or bile duct obstruction. Section 6. Silent no more. Recognizing the symptoms. Many people with gallstones don't experience any symptoms at all. These asymptomatic cases are often discovered incidentally during imaging tests for other conditions. These are called silent gallstones, and they often go undetected. Silent gallstones can remain in the gallbladder without causing any issues for years, or even a lifetime. However, when a gallstone blocks the flow of bile from the gallbladder, it can cause a sudden onset of pain and discomfort. This blockage can lead to a condition known as biliary colic. The pain, known as biliary colic or a gallbladder attack, is typically felt in the upper right abdomen, just below the ribs. This pain can be severe and may come on suddenly, often catching the person off guard. It can be sharp and intense, often radiating to the back or right shoulder blade. The pain can be so severe that it may be mistaken for a heart attack or other serious condition. This pain may come and go, often triggered by fatty meals, and can last for several hours. Fatty foods stimulate the gallbladder to contract, which can push a gallstone into the bile duct, causing pain. In addition to pain, other symptoms may include nausea, vomiting, and indigestion. These symptoms can be particularly distressing and may lead to a decreased appetite. In more severe cases, a blocked bile duct can lead to jaundice, which is characterized by yellowing of the skin and eyes. This occurs because bile cannot flow into the intestine and instead builds up in the bloodstream. Fever and chills may also accompany a gallbladder attack, indicating a possible infection or inflammation of the gallbladder known as cholecystitis. This requires immediate medical attention. Recognizing these symptoms early and seeking medical advice is crucial. Treatment options vary depending on the severity of the symptoms and may include medication, lifestyle changes, or surgery. With proper diagnosis and treatment, individuals can manage their symptoms effectively and lead a healthy, pain-free life. Section 7. When gallstones attack. Biliary colic and other complications. Biliary colic is the most common symptom of gallstones, but it's not the only one. This intense pain occurs when a gallstone temporarily blocks the bile duct, causing a buildup of pressure in the gallbladder. The pain can be sudden and severe, often radiating to the back or right shoulder. It typically lasts from a few minutes to several hours and can be triggered by eating fatty foods. Gallstones can also cause other digestive problems such as nausea, vomiting, and indigestion. These symptoms occur because the gallstones can interfere with the normal flow of bile, which is essential for the digestion of fats. When bile flow is obstructed, it can lead to a buildup of digestive juices in the stomach and intestines, causing discomfort and digestive disturbances. Bloating and gas are also common symptoms associated with gallstones. The obstruction of bile flow can cause the digestive system to become sluggish, leading to the accumulation of gas and a feeling of fullness or bloating. These symptoms can be particularly uncomfortable and may persist even after the pain of biliary colic has subsided. In some cases, gallstones can lead to more serious complications, such as cholecystitis, cholangitis, pancreatitis, and gallbladder cancer. These conditions require prompt medical attention and can have significant impacts on a person's health. Cholecystitis is the inflammation of the gallbladder, often accompanied by fever, chills, and severe abdominal pain. This condition occurs when a gallstone becomes lodged in the cystic duct, leading to inflammation and infection. If left untreated, cholecystitis can cause the gallbladder to rupture, which is a medical emergency. Cholangitis is an infection of the bile duct, a potentially life-threatening condition. This infection can spread rapidly and cause severe symptoms including jaundice, high fever, and abdominal pain. Immediate medical intervention is crucial to prevent serious complications and to manage the infection effectively. Pancreatitis is the inflammation of the pancreas, which can cause severe abdominal pain and other complications. This condition can be acute or chronic and is often triggered by gallstones blocking the pancreatic duct. Symptoms include intense abdominal pain, nausea, vomiting, and fever. Severe cases of pancreatitis can lead to organ failure and require intensive medical care. While rare, gallbladder cancer is a serious complication of gallstones. This type of cancer can be difficult to detect in its early stages and often presents with symptoms similar to other gallbladder conditions. Early diagnosis and treatment are essential for improving the prognosis and managing the disease effectively. Section 8. Seeking help. When to see a doctor. If you experience sudden severe abdominal pain, especially if accompanied by fever, chills, or jaundice, yellowing of the skin or eyes, it's crucial to seek immediate medical attention. These symptoms could indicate a serious complication requiring prompt treatment. Your doctor can diagnose gallstones using various tests, including ultrasound, Connecticut scans, and blood tests. Treatment for gallstones typically involves surgery to remove the gallbladder. The good news is that gallbladder removal is a common and safe procedure, and most people recover quickly. Section 9. Conclusion. Taking charge of your gallbladder health. Gallstones are a common health concern that can cause a range of symptoms from mild discomfort to severe pain and complications. By understanding the causes, risk factors, and symptoms of gallstones, you can take proactive steps to protect your gallbladder health. Maintaining a healthy weight, eating a balanced diet low in saturated and trans fats, and getting regular exercise can help reduce your risk. If you experience any symptoms of gallstones, don't hesitate to seek medical attention. Early diagnosis and treatment are essential for preventing serious complications and ensuring your long-term health and well-being.